Hello again, and thank you for joining us for today's session on frequently asked questions. This module addresses questions that many retirees have, and we hope that you will find it helpful. Question 1. What if I have 2 homes and travel quite a bit during the year? Answer. If you have a second home, travel extensively, or go stay with the grandchildren part of the year, you will want a portable medical plan, one that can travel with you. Usually a Medigap is a good fit for this lifestyle. With a Medigap, you will be able to access routine medical care in all 50 states and even have limited coverage while traveling outside of the U.S. Most doctors that accept Original Medicare will be happy to accept your Medigap plan for services. Question 2. What if I want to change my plan? Answer. If something changes in your life, or you feel like the plan you're in is not meeting your needs, you have the opportunity to change into a different plan during the annual enrollment period each year. Mark October 15th through December 7th on your calendar, and watch for your 2013 annual enrollment package to come in the mail later this fall. Question 3. Do I have to change plans every year? Answer. If you are satisfied with your plan and would like to continue in the same plan for next year, you may do so. Your plan will automatically renew without you having to do anything. Question 4. How do I know if my doctor or hospital is covered in this plan? Answer. Each Medicare Advantage plan has a physician directory online that provides a list of the doctors that participate in their plan. As an added measure, your benefit advisor will be happy to help you phone your doctors to confirm which plans are the best options for them, so there are no surprises after enrollment. Question 5. Can I get a printed copy of the plan I'm considering? Answer. Extend Health has provided extensive plan information for participants to use on the website www.extendhealth.com/SuperMedia. If you do not have a computer, your benefit advisor will be happy to talk to you one-on-one to provide this same information in the details that you desire. Another option would be maybe to ask a child or grandchild or maybe a friend if they could download it off of the computer for you. Once your enrollment selection is determined, you will receive an enrollment kit in the mail that will include a printed copy of your summary of benefits and evidence of coverage, along with your cards and contact information. Question 6. When will I get my ID cards? Answer. Your ID cards will be sent out to you after your enrollment is complete and your plan is issued. The carriers ask that we allow up to 10 weeks for them to get your cards to you, but usually it's much quicker than that. The important thing to keep in mind is that your coverage will be effective on your designated effective date, even if you've not received your cards. You may call Extend Health to get assistance if you have a doctor's appointment or need a refill prior to receiving your card. Question 7. How and when do I pay for my new plan? Answer. As mentioned in the presentation, Medigaps require that your first month's premium be made at the time of enrollment. As part of the enrollment process, you will be set up for automatic payments to be made on a monthly basis. If you prefer an alternate method of paying your premium, you may contact your carrier directly to set up your preferred arrangements. Medicare Advantage plans often have a $0 premium, so there's not a monthly premium to be made with those. If there is a small monthly premium, the carrier typically will send you a coupon book to use to submit your monthly payments with. You may also contact the carrier directly to set up an automatic payment method that suits your convenience. Question 8. What if I have pre-existing health conditions? Can I be denied? Answer. During your transition from group coverage, you are eligible for any Medigap or Medicare Advantage plan that you would like. You have what is called guaranteed issue. We at Extend Health refer to this as your golden ticket. This means that no pre-existing condition can limit your ability to enroll in the plan of your choice. You will not be subject to pre-existing condition restrictions or medical underwriting. If you use your election and enroll into a new plan in a timely manner with no lapse of coverage, you will be accepted into the plan of your choice, guaranteed. If you enroll in a Medigap plan when you first transition from group coverage and then later wish to change to another Medigap, you will most likely have to go through medical underwriting. There is no guaranteed issue at a later date unless you become eligible for another special election period. You will not necessarily be denied, but your premiums could be higher. Medicare Advantage plans always have guaranteed issue, but changes from one plan of this type to another must be done during the annual enrollment period for the following year. There is no medical underwriting required. Our Special Situations team is very skilled in these changes and is available to provide assistance throughout the year. With Medigaps, you do not have to wait until the annual enrollment period as you do with Medicare Advantage plans or Part D prescription drug plans. This concludes our frequently asked questions session for today. If you have any questions that were not addressed in the previous two modules or in today's session, please do not hesitate to give us a call. Our benefit advisors would be happy to speak with you one-on-one over the phone. That number, once again, is 855-535-7151. 855-535-7151. We look forward to speaking to you soon. Thank you and have a wonderful day.